Hi, guys, and welcome to another episode of VetFolio Voice. This episode features Amanda Schwarzwalder, who's a VTS or Veterinary Technician Specialist in Behavior. We sat down to review the role of a Veterinary Technician Specialist in Behavior and some of the common questions that behavior practices get from veterinary professionals and from pet owners. I love this episode because I really feel like there's something in here for everyone, whether you're new to the field of veterinary medicine and veterinary behavior, or if you feel pretty comfortable in your behavior knowledge. I know I certainly learned a lot from our conversation and took away some good points to keep in mind when managing behavior concerns. We kept the conversation pretty broad strokes here, but the number and variety of behavioral issues that practices dedicated to behavioral medicine see on a regular basis was really eye-opening. I am so thankful for our colleagues out there who help manage some of these truly difficult presentations. Let me tell you a little bit about my guest, and then let's talk behavior. For over 20 years, Amanda has worked as a veterinary technician in various capacities. Her interest in behavior led her to joining Dr. Feltus at the Behavior Clinic in 2009. She's a graduate of the AHA Distance Education Program at Cedar Valley College and attended Ashland University, majoring in history and geology before completing an additional degree in business in 2021. As the practice manager, Amanda's often behind the scenes, handling the day-to-day business of keeping TBC running, supporting referring veterinarians, and working with the TBC to assist clients and their pets. A nationally recognized speaker in veterinary behavior and fear-free approved speaker, Amanda enjoys teaching veterinary team members how to implement and develop behavior care as a team. When not at work, she enjoys hiking, reading, and hanging out with her husband Scott, their German short-haired pointer Moose, and the family Clowder, which I am slightly embarrassed to say as a veterinary professional, I was not sure what the word Clowder meant. It means a group of cats. So I hope I'm not the only one out there who didn't know that a group of cats was called a Clowder, but if you're like me, you've already learned something. All right, let's jump into our episode and learn more. Now, Amanda, you're a VTS in Behavior, a Veterinary Technician Specialist. Can you tell us more about yourself and, kind of getting that specialty designation? What does that mean? What do you do, kind of from day to day?
Oh, thank you for having me.
Yeah, absolutely.
It's going to be a fun time. So I actually started out in GP and got interested in behavior after seeing Ian Dunbar at a conference. And I was just like, wow, this is fascinating. And that was back in the 90s, the late 90s, early aughts. And it was just kind of like, wow, there's a different way to interact with animals. And there's a lot more that I don't know. And so that kind of started the drive to learn more about behavior and see how I could bring that into general practice. So I was running puppy classes, and I luckily worked for a veterinarian who was interested in behavior. So we did some behavior consulting for general practice clients. And then the VTS came about later in my career. It became an option. And so then I was like, great, we're going to do this. And anybody who's done a VTS knows that, like any specialty, it's a lot of work. It's a lot of dedication to your craft. And you really have to be committed to ticking all the boxes and getting your hours, because it's about 4,000 hours that you have to log working strictly in behavior and working with a veterinarian, because that's our goal as a VTS. It's about raising up that registered veterinary technician or credentialed technician into another level to increase that knowledge in a specialty area so that you can advance your career and do more. And that's really what it's done for me. It gives you that ability to express your passion in a different way. So there's cases that you have to do, and there's all sorts of skills assessments that you go through, that you have to learn how to do different skills that relate to behavior therapy. You have to understand the diagnosis, you have to understand the medications and the treatment process, and how the training in behavior therapy incorporates into the doctor's treatment plan, and how you work together to do that. So luckily, I was able to do that both in general practice and through owning my own training business, and then also leaving and going to work with a veterinary behaviorist full time. So, that's the fast track way to do it. Because it took me about 5 years to do my VTS, whereas the technicians that I mentor now that are in our practice, it takes them 2 to 3. It's a much more streamlined process because everything you do in a veterinary behavior practice is behavior. So that really speeds up the logging of the all the hours that you have to do. And you're using the skills that are required for that VTS every single day. So it's kind of fun.
Yes, yes. And, you kind of talked about the track that you took to get there and, kind of started at this place of this is really interesting and there's a lot that I don't know. And I think that's such a, an important thought process for any veterinary or medical professional. Like there's a lot that I don't know, so I'm going to learn all this stuff and there's probably still going to be a lot I don't know, but kind of continuing down that path. So keeping that kind of there's a lot that I don't know mentality in mind. What is one key point of behavior that you're like, we're never going to be able to wrap our head around the whole thing, but this is one thing that I really wish that everybody in the field would remember and keep in mind and use in day-to-day practice?
Body language. And body language comes into play because I'm a CVPM as well. So it comes in with humans and it also comes in with animals. But animal body language is a really, really big thing. There's a lot of misunderstandings, tail wags being one that a lot of people would be familiar with. And so when you know body language really well, there's a big difference between a tail that is held high and it's displaying a short amplitude tail wag versus a tail that's held at kind of a medium level and it's a very wide amplitude left to right wag. And then you've got the animals with no tails at all.
Sure.
So it makes it a little complex. But a lot of dog owners, will often misinterpret what that tail wag potentially means. Oh, he's happy to see me. And it's like, no, that's a short amplitude tail wag. That does not mean he's happy to see me versus the wide amplitude tail wag. That does mean that, things are a little bit happier. We are excited about that event. And it's one of the ways that clients and veterinary team members can get themselves in trouble is by not understanding body language. When we look at what we do through Fear Free, what we do through low stress handling and in behavior, when I'm starting mentoring a technician, that's where we start. We start with body language. It's the key thing that's going to keep my team safe. And it also is the key thing that keeps a lot of people safe, especially, when they're introducing children to the home or when you have guests visiting, understanding what your dog is saying can help you or your cat for that instance, or horse or cow. That helps keep anybody who's interacting with that animal more comfortable and safe as well. And you can prevent problems because that's a lot of what we do is we talk about management, safety, and prevention in behavior because that's, we can't always fix things overnight. It takes time. And that's one of the other big things I really wish people would understand is it's not a magic wand. It's not like the episode on TV where it's like, oh, it's fixed in one episode or 3 visits. A lot of these things take a long time because they've been practicing for 2 years or 5 years or 8 years. So they're really good at it. If you've been playing the piano since you were 5, you're probably really good. And that's the same thing with a lot of our patients. If they've been practicing aggressing unfamiliar people since they were 8 months old or a year, and now we're seeing them in the behavior practice at 5 years of age, it's a lot of practice. They're really good at it. So it's kind of interesting.
It sounds really interesting. And I love what you said there about body language because it says so much, both watching the dog's body language and understanding what they're telling us, and then being aware of our body language towards these animals as well. Actually just had the talk with my daughter this morning. We were driving to school where we were talking about different animals and, how cool it was that so many dogs would let us interact with them the way that they do, and cats and in a variety of species because any animal can have a bad day or be scared or, whatever happens. So, and they'll tell us that if we can figure out how to listen. Yeah, it's funny. We were just talking about this and I have no idea if she wrapped her head around any of it, but it was an interesting conversation for me.
Yeah. Yeah, and it is. And it's a really important thing for kids to learn. Because when you look at, especially when you look at our Instagram today, Facebook feeds, I mean, that's one of the things when you understand and body language, like I can't take my dog to the dog park, just makes me very neurotic.
Sure.
Because you see all the other animals that are actually very uncomfortable and they really don't want to be there. But, we use dog parks to be social for humans as well. It's one of the reasons we go to the people go to the dog park. I want to see my dog's dog friends.
Right.
And so it's a social connection for humans. And sometimes it is a fun social connection for dogs and they do enjoy it, but a lot of times they don't. And so the more we know, the more we understand. And it is something that, if you're lucky enough to have programs for kids that are happening as far as like Safety Town, where they talk about how to greet a dog, or if you are lucky to have a family pause educator, then that's really a neat program because that's giving kids information about how to make good choices around animals. Because if they look at Facebook, if they look at Instagram, we think we should just be able to get away with whatever we want. I should just be able to snuggle my cat and smooch him on the head and he won't bite me. So, and versus him going like, yeah, I'm not okay with that. I really would rather be sitting on the table next to you. I don't need to be, right in your face. You don't need to be touching me all the time.
So, right. And respecting what
respecting
these animals,
those boundaries.
Yeah, absolutely.
Yep.
Absolutely. And, a lot of the boundaries that we have, and, we're all different as humans in that way with our boundaries. And so understanding animals are the same way. It makes a lot of sense.
Yeah. I mean, not everybody wants you to run up to them and be like, oh my goodness, I haven't seen you since last year, and give you a big, like, you have a big hug.
Right.
Some people are like, hey, let's just wave across the room. Good to see you at the conference. So I'm headed out to an event. And yeah, if I just ran up and hugged everybody there and told them, oh, you're such a cute practice manager. I've missed you so much. Like we sometimes do with our animals. They're going to be like, wow, you probably needed to get a vacation before now.
Yeah. You need to see some people, get some of this out.
Yeah. Like something's happening here. It's not going to be socially acceptable. So we have ways of communicating what is or what isn't socially acceptable. And animals do too. And that's that body language. So the more you know about where the ears are sitting, the eyes, pupillary dilation, can you see the whites of the eye? Because sometimes it's normal in some species and it's not normal in other species, unless they're very anxious. And we talk about whale eye in dogs, where you can see the white of the sclera. And then also the tail wags and body tenseness. We tend to go like, oh my goodness, their hair is standing up. That cat is all piloerect and poofy. Looks like the Halloween cat. And we go, ooh, they're not okay. But we've missed, when they get to that point, we've already missed a ton of other subtle signaling to tell us that they were uncomfortable before we get to that part.
Well, let's dive into that a little bit in the veterinary clinic, because like you said, when we have the bottle brush tail and, like the Halloween cat, that's exactly what they look like.
Yeah.
And that the cat is about to glue itself to your face if you push it too far.
Yes.
So what are some of the things that we can keep in mind when we're bringing these cats in to help them be more comfortable, and then the signs we can look for that they're getting uncomfortable? And I know something we've talked about that a little bit on the podcast before and covered it, but I feel like it's so important because, for example, I had a little kitten in yesterday for a spay, and she was the sweetest little kitten, but she was nervous and you could tell. So, we put a feel away towel in the bottom of her kennel, and then we just gave her another one to hide under. And she was like the happiest kitten. As long as she could hide and just poke her little nose out every now and again, she was so happy. So what are some of the things that you maybe do in your own practice, or you wish that you saw more in private practice to help head off that anxiety, especially in our feline patients?
A lot of it's starting before you even leave the house. So helping clients understand carrier training and that it's important, and also making sure we have the right and appropriate size carrier. My 21 pounder is not going to fit in, a teeny tiny canvas bag that's made for an 8-pound cat. And if I try and put him in there, I'm already creating stress and anxiety before we even leave the home. And so having carriers out, having towels out that smell like home. One of my guys had to have a dental cleaning recently. And so I took him, he's got his carrier with his feel away towel in the bottom. I had another towel over top to help during transport because he gets a little motion sick in the car. So with the towel over top, he can't see things flying by the window, not tempted to look out as much, to help him be a little bit more comfortable. It also smells like home. And then when we got to the clinic, I kept him covered until we got him into a room, because it's a mixed dog and cat area, and lots of activity, lots of people and noises. So the towel can also help dampen some sound as well. And so that's beneficial. And the other thing that I try and do is I always try and lift carriers from the bottom versus holding the handle. And I think that's just years of working in vet med when they suddenly just fall apart.
Yeah.
Or you realize there are only like two bolts holding the whole thing together when you go to take it back to the treatment. You're like, oh, yikes. So making sure that carrier's in good condition, lifting from the bottom so that it's not going to fall apart. Because sometimes these carriers have set in some really interesting places.
Yeah, I was going to say, I'm picturing like the carriers where like you put it on the table and like a spider
Yes.
crawls out of it. And I hate it when that happens. And it kind of speaks to, like you said, this all starting before you even leave the house. Like I wouldn't want to be in a carrier where like a spider crawls out or a cockroach crawls out because it's been stored in a barn for 6 months.
Exactly. Yeah. It's just, and again, imagine how that smells to the cat. I mean, they have a very enhanced olfactory sense. So, you're bringing this musty, stinky thing out of the garage and they haven't been in it for 2 years. But today, they need to go because it's vaccine day and they're just like, whoa, this thing smells musty and weird. And yeah, it's got friends that I don't want to hang out with inside of it. And so, yeah, we're already starting off on the wrong leg before we even leave the house. And then, the other part to that before you leave the house is even, can we use some PVPs ahead of time? Can we use gabapentin? Can we use trazodone in addition to feel away? So things to help, or, even like if they get a little stoned with some catnip, some silver vine, like having some of that available. So they're just like, yeah, I'm going in my house. I'm going to have some good fun things to roll on. It's, I feel great. Don't care that mom drives like a crazy person on the highway. We can't see that. And then when we get to the clinic, yeah, we've got those things that smell like home. If they are, sassy about the vet clinic, then they already have medications to help them feel a little bit better about that. If you're a little bit anxious about a medical appointment and you were able to have a couple glasses of wine ahead of time, you might do that.
Absolutely. Absolutely. And that's sometimes how I explain it to owners when we're talking about pre-medding dogs and cats. I'm like, look, there's plenty of people who can't go to the doctor, who can't go to the dentist without medication. Or,
exactly.
they're the white coat hypertension and all of this. So, and they know they're voluntarily taking themselves to these offices. Like we can't explain this to your pet. So why don't we just, treat them, give them the same respect we would give to ourselves and our, our human companions and take some of the edge off for them.
And then once we're there, it's nice. They have those things that smell like home. I was kind of startled because it's fun being someone who's a specialist in behavior and I'm a fear-free speaker and I'm a CVPM and I do a lot of things to educate veterinary practice teams. And so where I took my own cat, I was like, no, take the screws out. And she's reaching into the carrier to pull him out. And I'm like, oh no. And it's just like, oh, please let me just help you.
Yes. Like that's a scary, you have a big old hand coming at you.
Yeah, exactly. Yeah. Because from the cat's perspective, or the dog's perspective, when we're going to get dogs out of kennels and we're leaning in and reaching in. And again, if we're not watching for the body language changes, that's where, again, we can get ourselves into trouble.
Sure.
Or situations, we don't want to put the patient in and enhance their fear and anxiety. So it's like take the screws off, do kitty on the half shell, unzip the bag. If they're really sassy, you can inject through a carrier, you can inject through the cloth carriers. There are lots of creative ways to still get treatment happening, or at least get sedation happening, because then they don't remember. And that's great.
What about owners? When we're talking about owners here, I think, all of that those are really good things to keep in mind that we need to be doing in the veterinary clinic, and talking to owners about making sure that we're prescribing gabapentin, or other, pre-visit anxiolytics when they're appropriate, making sure we're using feel away, we're not reaching in the carrier, grabbing cats, all this kind of stuff. What about owners and, some of the behavior consults that they seek? What are some of the common questions you get?
So for us, in our practice, we get a lot of aggression to either other animals, and they can be other animals like my dog sees unfamiliar dogs on walks, to we get a lot of inner dog aggression cases. And then we also see aggression to humans is another common call. That's a big one that we get. Separation distress, generalized anxiety. So I talked to a client last week who was just beside himself because his dog they adopted it from rescue and they're trying to, do some house training, and the dog is just petrified of outside. It's like, I don't know why you want to take me out there. This is awful. It's it's trying to potty in the yard, but it doesn't complete. And so it comes in the house and completes in the house because just the noises and the traffic. They live near a highway. They don't have a big yard. So it's just a lot. And so that's a common one. And that can go into all sorts of global fear and all sorts of fun things. But we see lots of questions about, my dog is just anxious. My cat is anxious. And cats out of the box. That's another common call. Lately, I think we've got 3 different cases coming in that are cats aggressing other cats in the household. So people are trying to integrate households and it's just not going well. So that's a lot of our caseload is, spread between those things.
Sure. So aggression and anxiety in dogs and like you said, cats outside of the box where, yes, as soon as we stress them out for one reason or another, I'll never forget a case that I saw it was a cat who was peeing outside of the litter box. And, we were kind of going through like, what changed? What's stressing this kitty out? What could it be? The owner had moved a chair from one side of the room to the other and the cat was not okay with it. And that was the only change. And she moved the chair back and the cat went back to peeing in the box. It was, you never know what's going to set them off.
Exactly. They're so sensitive. We had a similar case where they bought a new recliner. So they got rid of the old chair and they brought a new recliner into the space. And the cat was like, no, I'm not going into that room. There's something evil in there. And so it was kind of fascinating because the client, same thing. They're like, I don't understand why she suddenly isn't using the box. But it was this weird, electric recliner. So it made noise and it moved differently and it smelled like the store. And it was just very concerning for that cat. So they are very sensitive. I mean, my own personal dog has generalized anxiety disorder. And so sometimes he's like, what do you mean? Why did you move that there? The lawnmower is in a different place. It's just like, it's still the same lawnmower. It's just 6 inches to the left instead of to the right, but he notices those things. He's very hypervigilant about those things. And it's, unless you have anxiety as a human, sometimes some of those things can be hard to understand.
I love that you're bringing up all of these examples because, I just think it's important to remember that all of these things can happen in our patients. Like you said, generalized anxiety, cats who are very sensitive to even the slightest changes in their household, dogs who don't like unfamiliar dogs. And like you said, with some of the messaging that we get online and especially through social media, it can seem like, every animal should be squishy and friendly and all of this. And so really important to remember that this can happen in our own pets. This can happen in a lot of our patients and to make sure that we're addressing that with owners if we're starting to see signs that this is a problem.
Yeah, the sooner you can catch it, the easier it is to start making changes and maybe head off more advanced progression of the disease process in the future. And I think one of the other things, like I've had 2 different clients this week. And so it's really important for clients to understand and for veterinary team members to understand that sometimes behavior problems develop and the client did nothing wrong. They have done everything right. They got the puppy from a good breeder. They did all of their research. They've gone to puppy class. They haven't used any punishment. They're using all positive reinforcement, and we can still end up with a problem. And that's something that, we find ourselves like twice this week. I've had the conversation with a client of like, you didn't do this. This is just the way your animal is. You have done everything correctly, for whatever reason, whether this is something that related to attrition in utero or stress on the mother, like things that affect brain development before the puppy or kitten is even born. All of those things can play a role and we have no control over that. You can do the best that you can and we can still have pets with behavior problems. I think sometimes it's easy to want to be like, oh, the owner must have done something. Or you can also be in a situation where the one client broke down crying because she's like, people keep asking me like what traumatic situation my dog experienced to make them this way. And she's like, and I've had him since he was 8 weeks old. And I haven't nothing. There's been nothing. I mean, sometimes we know. So I have a cat who's a patient who was in a house fire. And so he has significant burns. And so he's had a very traumatic experience. We've had dogs who've been chained to trees and left in parks, who've been patients. I mean, you do sometimes have a known trauma, but a lot of times you don't. And so a lot of times our clients are rescuing pets and they have no idea what happened before they got them. So I think it's just always important to be supportive of the owner, help to educate them, but also don't be afraid to let them know it's not their fault. And even if they are, I mean, we're behavior. So sometimes you get somebody who comes in and, they're wearing, their little buzzers for their shock collars, or they've got a prong collar on, and they were still doing the best that they could, trying to get information and trying to get to help. And they finally landed in your office.
Right.
And that's what I try and teach my team. Like they're here for help. They were doing the best they could with the information they had up to that time. And now they're here and we get to take them to that next step. They're trying to fix a problem. And sometimes some of these problems, especially when we're dealing with aggression, clients don't know what to do. And they're looking at like, okay, well, I don't know if my vet can help me with that. Or I don't know, like the trainer said to do this. So they're going with the advice of someone who is an expert in their eyes, and they're just trying to get help for their pet.
Yeah, absolutely. As a general practitioner, I know I find myself sometimes at a loss when an owner does bring a behavioral problem to me. I mean, certainly, using gabapentin and trazodone to come into the vet, or, helping to figure out what's stressing out a cat who's peeing outside of a litter box or something along those lines, I feel okay about. But there are certain behavior things, like inner dog aggression and, even human aggression, things like that, that sometimes I can help. I feel like I can help sometimes on the pharmaceutical side, understanding some of the medications that may make these pets more receptive to what their owner is trying to accomplish. But as far as the actual like behavior modification side and what to tell them to do at home, sometimes I'll be honest, I feel at a loss where I'm like, I don't quite know how to do this in the home, because I do this in the clinic. And I do house call medicine. Sometimes I go to people's homes,
Right.
but I will often tell them to, consult a behaviorist or consult a trainer or something like that, because it's just not where my knowledge base lies. What are kind of some things we can keep in our hip pocket to say, all right, here's kind of some basics that you can try before, I refer you to a trainer, to a behaviorist, et cetera?
So when it comes to aggression to people or aggression to other animals, you're base set as a technician. And that's the cool part about being a veterinary technician specialist, is you've got the training education and you have the medical education as well that go together. So for us, we're looking at, what is the severity of the aggression is really important to know, because that should advise what you're doing for treatment and what you need to do to help them stay safe until they can get to the next step for help. So anytime we have dogs who are fighting, I want to assess, or even aggressing humans, I want to assess their bite score. That's one of the first steps that you can take to kind of get information on the severity of what's happening in the home. And so if there are bites that have happened, so Ian Dunbar has, there's a bite scoring system, goes from 1 to 6. So 1 is actually just growling. So if we've got a lot of just growling at each other or growling at the human, that's still a bite score of 1. And because they're telling the owner or the other animal, like, hey, stop. I'm uncomfortable with what's happening. Just stop. And that's a great place to be, because we can make a lot of change. We've got good communication happening from the animal to the human that we can teach them to recognize. And we can go, okay, well, when does this happen? Oh, if you're getting the growl when you go to reach over and clip the harness on. Great. Can we use a different piece of equipment? Or we're going to work on desensitization and counter conditioning to that piece of equipment. And so we're not going to use it. In the meantime, you've got a fenced yard. Great. Let's just go out and come back and work on making that harness a really good thing. That's really fun. So a bite score of 2, now we have teeth making contact with the body. And it might just leave a little red welt, and we're not really getting a lot of bruising. As we go up to a bite score of 3, now we're getting some bruising, and we might start to get some scratching, to even like a little bit of a puncture through the skin. Then we get into a bite score of 4. And between 3 and 4, where we're starting to have some teeth going through the skin and making deeper punctures at a 4, we're actually getting indentations and that deeper puncture, then that's something where we get a little bit more concerned, and we start to say, yes, we need to talk about medications. We maybe need to talk about, if this is happening in a daycare situation and your dog is biting a dog and leaving puncture wounds on another dog, we probably shouldn't be going to daycare. So are there things we can do to manage the environment and say, great, we don't need to put you in that situation where you're so uncomfortable that, we can avoid that while we work on, again, figuring out what's going on. And then also, again, when we're looking at that with humans, we look at, like, once we get to a higher bite score, how frequently is that happening? If it's like a one-off where, the dog's been going to daycare for 6 years and this is the only time it's happened, maybe there was a one-off something that happened that day that we can address versus if this happens once a week, like we need to be having a more serious conversation. So it helps to kind of drive, knowing some of the bite scores helps to drive where we need to go. When we get into like a level 5 and a multiple concerted repeated attack, which in my world we see unfortunately a lot. That's usually can be a triggering incident for people to call a veterinary behaviorist is after another animal has been attacked at that level. So it's lots of bite, 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 and they have a very difficult time stopping. And level 6 is death of the victim. That's not where any of us want to end up. And there are a lot of squirrels that end up in that bite level, but it's, something we want to avoid when we're talking about our housemates or our humans for sure. And so once you're at like 4 or 5, then we're having conversations that are, you need to be muzzle training. We need to be talking about getting a referral because it's a much more serious incident. And sometimes in those situations, we need to be talking about behavioral euthanasia. I actually had 2 cases in the last 4 days where those were the conversations that we needed to have because the client ended up in the ER in the one case, and another case, the dog killed another dog. And so those are the cases that we get in our practice that I hope you don't get. But when you do, knowing that information, being able to ask like, well, what did the bite look like? When did this happen? Is this the first time this has happened? Does this happen a lot? That can help you gauge again, where they need to fall. So once you're hitting kind of bite scores, 3, 4, 5, we definitely should be talking about referral. We definitely should be talking about medication, muzzle training, and what are we doing to manage? Like if we're having dog fights in the home, maybe we not need to like separate. We need to separate the dogs. Let's not let them practice aggressing each other every day. If we're aggressing random dogs on walks, is it I only get aggressive to Yorkies? Or is it I get aggressive to Yorkies and Pit Bulls and German Shepherds and everything I see, and it's at the level of the horizon? So, then we say like, okay, again, maybe we don't need to go on walks. Are there other things we can do to burn energy and manage? So there's so much. That's what this is. This is a fun topic because this is what I get to do every day. But there's so much that goes into all the different management and safety and prevention pieces. But I think the biggest thing is to identify like, well, where are we at on that bite level scale? Are we having injuries to humans or animals? How frequently does it happen? What's the intensity of when it happens? And then also looking at, is everybody okay? How does everybody in the household feel about this? Because not everybody in the household may feel the same. We have families that some people are like, nope, I don't care that he reacts to other dogs on walks. Yep, he got up to that one and bit it, but it was the other dog's fault. Or, they have their own mindset and it's going to take a while to get them there. And that's going to impede treatment no matter what you're trying to do because it takes a lot of talking. But in other households, they need to have that conversation with you about, yeah, my dog bit my kid today. Okay, tell me what was going on. Tell me what the bite looked like. Show me a picture. So those are things that when you get those, being able to have a technician on staff, if you have a technician on staff who likes behavior, they can triage through some of those things for you and start to gather that information and help them decide like, oh gosh, this actually happens every day. And yeah, it's only, a level 2 bite, but it's, we're looking at a toddler. Then like we need to get you in, you need to see the doctor, and we need to start talking about safety, prevention, and management. So, having barriers up and safe zones for the kids, and also, looking at safe zones for other animals in the house. If we have aggression between animals, how do we do crate and rotate? So there's so much. This is like 6. Sure. This is so much. There's 6
so
podcasts
much.
Here. So
yes, I was just thinking that. I'm like, man, I'd love to dive into some of this stuff, in more detail and, learn about some of these techniques and things that, we may be able to help clients with on the way to getting perhaps some more advanced help, suggestions that we can give to them in the meantime. I'm kind of understanding how those work and being able to implement them correctly. Gosh, I feel like you've given us just like so much to think about here in terms of the wide world of behavior and how much there is. And I think a couple of the takeaways that I really got out of this talk is I feel like, well, okay, I think one of the biggest takeaways that I hear listening to you is every dog is different, every cat is different, every situation is different. And there are so many variables to keep in mind. And, not everything is going to fit into a box of like, when this happens, then you do this and et cetera, et cetera. So making sure that we're keeping in mind the individual variables for that particular animal, for that particular situation. And, that we're trying to be sensitive to, and not essentially not try to take a round peg and put it in a square hole.
Yes. Yeah. And I think that's the one thing that for me as a technician that makes the VTS and behavior so interesting is that it's not black and white. There's lots of gray. It's really easy to sit down and say like, well, this is a cat out of the box. You do A, B, and C. But there's a reason we have an 18-page history form. There's so much that goes into information collection to be able to get the owners on the right path. And even with all of those pages, we still sometimes miss pieces that the clients don't know are important. And so, it's like if you watch any murder shows, they're going through and like, why didn't you tell us this earlier? Oh, I didn't think it was relevant. And our clients are the same way. And so you can sometimes find out those little pieces through advanced, conversations and communication. But that's one of the things that you really have to like talking to people and like digging for those little pieces. But yeah, that's the hard part because we can have textbooks and it's fascinating too that even within groups, within the behavior group, there can still be some of my favorite discussions to listen to between veterinary behaviorists are when they're talking about diagnoses and why they think one I want to call it this and this is why I think it's this and this is no. I mean, it's fascinating because they have different pieces of information everybody brings to the table. But there are a lot of different things and there are a lot of different variables. And the fun part is working for veterinary behaviorists, it's not just one diagnosis. I mean, a lot of our patients have multiple diagnoses. And that's why sometimes I get jealous of general practice because you guys can be like, kidney disease, we got drugs for that. And we're looking at like, okay, I've got separation related disorders. We've got some sort of aggression that's happening to the housemate. Oh, and by the way, they don't know how to tell their owner they need to go potty. And so we've got all of these clusters of things that all go together. So it's like, oftentimes, we're going to talk about, the potty habits and we're going to talk about the separation distress and we're going to talk about the aggression and we got to put it all together in an hour and a half. And it's a lot. So it's kind of like the dog that comes in that hasn't been seen by a vet in forever and it's all matted and it's got fleas and, oh, by the way, it has this and that and the other from a medical component. Those cases, you're like, oh my goodness, where do we start? And that's sometimes how we feel with behavior. Like, where do we start? We have all these different things to help the client, but having the conversation with the client sometimes too, and saying like, okay, these are all the diagnoses. These are the things we're concerned about. Here's what we're thinking. How do you feel about this?
Sure.
Yeah, is also, an important part of that conversation because if you're saying, I need you to separate your dogs who are trying to kill each other, and they're like, we can't do that. We have young children in our house who can't keep doors closed. That is going to impact what you recommend for treatment.
Absolutely.
So, there's lots of little pieces like that. Or grandma comes over every day at noon and lets them out, and grandma can actually, get them in their muzzles. We can, but they can't. And so you have all of these different things that you have to manage and sort through. So I wish it was round pegs and round holes. But a lot of times it's like that ball toy that you had as a kid, and it's like all the shapes, and you got to put all the shapes in all the holes, and it won't work until you do that. That's sometimes what it feels like.
Yeah, there's so much of medicine that's like that in general. That's what keeps it interesting and makes our jobs fun. Well, Amanda, this has been such a fun conversation. I just have so many more questions. Like, I want to talk about how these appointments work and how the follow-ups happen and different cases and all of this stuff. So I really hope you will join me again and we can continue this conversation, because even I feel like we touched so briefly on so much here that you can tell there's just a depth of knowledge, and I want to learn about all of it.
Well, you can come. We need another behaviorist. Just come to Ohio.
There we go. There we go. I don't know.
We got this.
I lived in the Midwest for a long time. I'm going to say I think I'm a Florida girl for the foreseeable future here.
You're not interested in our beautiful Cleveland snow.
Oh my goodness. Oh my goodness. Well, and in fairness, I was from Illinois, which may have like Northern Illinois, which has like the worst weather in the entire country. So maybe I'm a little biased.
Yeah, there you go.
Well, Amanda, thank you so much. This has been so much fun. And like I said, I really hope that we can do it again and dive into more of this conversation, because you can tell that there's just so much there.
Yes. Yeah, there is. There's a lot. It's what's kept me going for all of these years. So there's just too much.
Keep doing a good job. There's so many people out there that you're out there helping. So thank you for coming on and sharing some of that with all of us. And like I said, I hope that we can hear more in the future.
Yes. Thank you for having me. I enjoyed it.
Amanda, thank you so much for joining me. I really enjoyed our conversation. This was such a fun episode. And of course, a huge thank you to everybody out there who tuned in. For more episodes like this, click on the Education tab on the VetFolio website. As always, we'd love to hear your input on this talk, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassi DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.